Hey everybody, and welcome to another lecture from CyberMD. Please be sure to like, comment, and subscribe to all of our content so that we can continue to provide free medical education resources to students around the world. Today we are going to cover a topic known as Premature Ventricular Contractions, or PVCs, as a part of our Common EKGs lecture series. PVCs are abnormal heartbeats that occur in the ventricles, the lower chambers of the heart. They're a common arrhythmia that can cause concern for patients. Understanding PVCs and how to diagnose and treat them is crucial for anyone studying for the USMLE STEP 1 exam. Let's start with the etiology of PVCs. The cause of PVCs is the initiation of a ventricular contraction from the Purkinje fibers instead of from a signal that traveled from or originated in the SA node. If two occur back-to-back, this is called a doublet, while three are called a triplet. Any more than that would be considered ventricular tachycardia. Additionally, if the PVCs have different waveforms, then they are called multifocal, as they are originating from different sources. Risk factors include heart disease, heart attack, and hypertension. It's important to note that PVCs can occur in individuals of all ages and are relatively common, showing up on 1 to 4% of EKGs. Now, let's discuss the pathophys. PVCs occur when the electrical signals in the heart do not follow a normal pathway. Instead, the signals start in the ventricles in the Purkinje fibers, and this leads to an irregular heartbeat. This can cause symptoms such as palpitations, lightheadedness, or chest pain. When taking a patient's history, it's important to inquire about the symptoms and the duration of PVCs, as well as any underlying medical conditions. During a physical exam, the healthcare provider may listen to the heart sounds and check for any signs of heart disease, such as murmurs or swelling in the legs. The evaluation of PVCs often starts with an EKG. PVCs are easily recognizable on an EKG as they appear as abnormal beats in between the normal beats. They can be single or multiple and may occur in series. They are characterized by wide, oddly shaped QRS complexes. When it comes to treatment and management, PVCs are usually not treated if they are occasional and are not causing any symptoms. However, if PVCs are frequent or are causing symptoms, treatment may be necessary. Options may include medications to control the heart rate, such as beta blockers, or to decrease the number of PVCs. You may consider antiarrhythmic drugs or calcium channel blockers. In severe cases, a procedure such as an ablation or a pacemaker may be necessary. It's important to consider the differential diagnosis when evaluating PVCs. Other conditions that can cause similar symptoms include supraventricular tachycardia and ventricular tachycardia, as well as premature atrial contractions. Therefore, it's crucial to obtain a thorough history, physical exam, as well as an EKG to distinguish PVCs from these other conditions. The prognosis for PVCs depends on the underlying cause and the severity of the symptoms. In general, PVCs are not dangerous if they are occasional and again not causing any symptoms. However, if they are frequent or they are a sign of an underlying heart condition, the prognosis may be more serious. Finally, it is important to be aware of the potential complications of PVCs. PVCs can lead to an increased risk of dilated cardiomyopathy as well as an increased risk of heart attack or stroke. They can also cause anxiety or fear in patients, which can further affect the patient's quality of life. In conclusion, PVCs are a crucial topic for anyone studying for the USMLE STEP 1 exam. Understanding the etiology as well as the pathophysiology, a differential diagnosis, treatment, and prognosis, as well as potential complications are essential for people looking to diagnose and treat PVCs effectively. Remember to take a thorough history, conduct a physical exam, and get an EKG to diagnose those PVCs. When it comes to treatment, be aware of the options that are available for your patients, and always keep in mind the potential complications and the importance of monitoring patients with PVCs for any changes in their condition. Thanks so much for tuning in.